Okay, so we're gonna inject Sarah's forehead, and this is a really good example of someone who may come in and say, I don't like my forehead, I don't like my horizontal, they'll call them their wrinkles, but again, they're not wrinkles, they're lines of facial expression. So go ahead and raise your eyebrows up so you can see that when she engages this muscle, the skin is sitting in grooves in the muscle. The fibers of the muscle run this way, and when those fibers contract, they lift the eyebrows up. So the problem here is Sarah has a really nice eyebrow, but you can relax your forehead, but her eyebrow sits low and flat. So it's not a super feminine eyebrow. It's a little bit more masculinizing on her face. So the last thing I want to do is flatten her brow even more. Okay, she will hate that, and she won't be able to get makeup on. She won't be able to lift her brow at all. So if I only put product in her upper forehead and I took out the muscle that raises the brow and I left unopposed brow depressors, go ahead and frown, okay? That would potentially be the net result of her neurotoxin, with her brow really flat and down like that. And that would be a really bad, that would be bad functionally as well as aesthetically. So even though she doesn't have super significant creases here, we have to treat her forehead as one unit and keep everything in balance. So go ahead and frown for me. So I'm gonna put an injection right into the belly of the muscle here. And again, we're not treating the lines, we're treating the muscle. And then I'm gonna measure with my finger. So I'm gonna feel for the bottom of her orbital rim, and I'm gonna measure a centimeter outside, and I'm gonna put an injection point there. And again, always keeping product bilateral and symmetric so that one eyebrow doesn't get raised or lowered more than the other. So anything that goes in on one side has to go in on the other side. Go ahead and frown again, and you can see how much she recruits from her corrugators over here. Okay, relax. So now I'm gonna put a second injection point for this muscle complex. So I'm feeling it, I'm not using her eyebrow, I'm feeling for the bottom of her orbital rim. I'm finding 1 centimeter, so I know I'm outside and not gonna have product diffuse into her orbicularis muscle around her eye. And I'm gonna make similar injection on each side. So those are the injection points for her frown complex. Now she doesn't have a super high forehead, but she's got a very wide forehead. And so I'm gonna use product. How many did we draw?
10.
2, 3,
No.
4, 5,
6.
6. And I'm just gonna space these out and keep them symmetric. Okay. Now, for Sarah, I am using Jeuveau, and Jeuveau is a newer neurotoxin. It is very comparable to Botox in how it feels and how long it lasts. It's a nice light product. Dysport tends to be a little heavier. What I mean by that is Sarah doesn't like Dysport in her forehead. It makes her brows feel too heavy. So the Jeuveau diffuses a little bit better in the muscle, and it keeps things a little bit lighter, which is more natural feeling. The thing with Jeuveau is if you look at these syringes, there is a lot more fluid in these syringes than in the other injection videos. That is because Jeuveau is mixed with 2.5 cc's, not 1 cc, so there's much more fluid in the bottle. And so the math for this is that 10 units of fluid is 4 units of Jeuveau. And so each of these injection points on her is going to be 4 units of product. So each one of these is getting 10 units of the syringe. And then each of these, we like to use about 2 units of Botox, so comparable to that in 5 units of fluid. I'm going to have about 2 units of the Jeuveau. The nice thing about using a larger amount of fluid in the upper forehead is more fluid can theoretically diffuse a little bit more laterally and through the muscle a little bit more evenly. So in people who haven't had great results from Botox, using this product actually in the upper forehead is beneficial because you can get less product to go further in the muscle. You have to be a little bit more careful with this in the glabella because since you have a larger volume of fluid, if you don't inject properly and that fluid diffuses into the muscle around the eye, that's when you can get a drop in the eyelid, where the eyelid sort of sags a little bit. So again, my injection technique is gonna have to be, I'm gonna be careful with my injection technique.
Is there a leash in the mudroom?
Yes.
No?
Yes.
Okay, yeah. She said there's a leash.
Okay, frown for me. So I'm gonna grab the muscle between my fingers. And again, as I pop through the dermis, I feel the resistance go away. Now I know I'm in the muscle, and I'm just gonna carefully inject between my fingers and kind of massage it right into the belly of that muscle. So again, not treating the lines, treating the muscle. Okay, here, just close your eyes gently, have your forehead relax. I'm gonna put my thumb underneath and I'm gonna give a little bit of counter pressure, which is gonna help protect the product from diffusing down. And you just don't wanna ever inject down towards the eye. You wanna inject either totally evenly, or I like to go up and in a little bit right into, we know the muscle runs this way. So I'm in the belly of that muscle, I pop through, my resistance goes away. And now I am just carefully injecting right into the belly of that muscle. Same thing again, her second injection point, a little bit more lateral where she recruits, going right into the belly of that muscle. Same thing on the other side. So my finger underneath, a little upward pressure into the belly of the muscle. I pop through and I'm injecting. People will bleed a little bit, especially if they're taking aspirin or ibuprofen. You can do this to people who are on blood thinners. It's a tiny little needle. You can have them hold a little ice before and after. If they're on blood thinners, again, just be careful not to go right into these veins, because you can really get a lot of bruising. And you just have to warn people if they're on blood thinners and they want this done, that they can get pretty significantly bruised. So these injections, again, in the upper forehead, I'm not going super deep. I'm certainly not going in and hitting periosteum and then pulling back. That's not a good injection technique, because people will get headaches. So I'm really just popping through, and then I'm injecting carefully. And if you're a little high here, it doesn't matter. The product will diffuse into the muscle. I drew this right over this vein, so I'm gonna come a little bit medially, it doesn't matter. And I'm gonna stay off that vein so that I don't give her a big bruise. And you can see it wheels up a little bit, and then those wheels will go away very quickly once we massage the area afterwards. Okay, and all of her product is in. And I will wipe off her injection points. Again, I use a Crayola washable marker rather than a surgical marker, because the surgical markers are impossible to get off of people. So if you're running a busy cosmetic clinic and you want to be able to get people in and out quickly, in some of the videos you saw we use the white eyeliner crayon. That's really easy to get off of people. And then just having a box of Crayola washable markers in the office is always really helpful, because it's really easy to wash it right off. Okay, and then I'll have her hold pressure where she's oozing. Just reach up and hold some pressure there. She'll hold pressure for a few minutes just to minimize any bruising, and she's all done.